Story, very serious stuff. The American Cancer Society releasing new guidelines for breast cancer testing. Screen later and less often. Dr. Alexandra Sowa is here. First of all, this new recommendation comes about because, as I understand, there are a lot of false positives and therefore a lot of procedures later which were not necessary. Is that accurate?
Yes. So guidelines like this look to maximize reductions in deaths from breast cancer while minimizing harms caused by screening on a large scale.
Okay.
So studies consistently show that earlier screening doesn't necessarily lead to decreased death down the road, and it leads to more interventions. So if you have a false positive mammogram, and we see these in women under the age of 45 because of denser breasts, it might lead to unnecessary interventions, repeat screenings, biopsies.
But you presumably, you think this is more of a personal decision? Because I know a lot of women who say, look, early intervention, early testing, that's the key. Find it early.
Yes.
You with me on this?
I am a fan of shared decision-making between a patient and a doctor. I tell my patients all the time, you're not a guideline, you're a person. So I think the power really needs to be between a patient and her physician.
Sure, but you know, you've got mass confusion right now, haven't you? I mean, everybody's confused. What does this mean? What should I do?
I know. It's very confusing. And hopefully, if you take this question to your doctor, they'll be able to help you navigate. I think that there is even confusion within the medical community. And there's going to be a lot of pushback because now we have 3 big guidelines saying different things.
What do you do in your personal practice?
I advocate for generally less is more. I like less screening, but you need to identify who is at higher risk for breast cancers.
And how do you identify that?
So anyone with a family history or personal history of any cancers. Okay. Obesity, smoking, radiation to the chest when you were younger. Okay,
all of those factors you would take into consideration.
Absolutely.
And maybe recommend early testing.
Yeah, and even personal preference. If a woman is really nervous, you need to go forward with it because everyone has personal relationship with breast cancer.
Doctor, thank you very much for explaining a very difficult subject in a very meaningful way that we can all get behind. We appreciate that, Doctor.
Thank you.
Thank you very much.